Picture this, a mother, 44 years old, mother of two, out for a walk in her gentrified street, just not far out of the downtown core, when all of a sudden a bullet rings out of nowhere and ends her life like that. Just like the last scene in The Sopranos. Her life is gone. But what if I told you part of what was responsible for her death was healthcare policy? I'm Ross McLean. Let's get into this now. I've talked to you enough about issues surrounding narco states, the drugs that go on between Mexico, Canada, and the U.S. It's a North American problem, the way the drugs are moving around. But why don't we also talk about that little-known area of healthcare policy where is the government involved in helping causing all these drug problems? Look, policy is big these days, right from looking at the Obamacare still to see if that should be wiped out and the money go to people rather than to the companies. There's a lot of money in healthcare. RFK Jr. is digging into it and uncovering and just trying to eliminate mistakes. You know, it's one of the secrets of life that sometimes the fastest way to get ahead is not that you have to start doing something new, but that you just stop doing something bad for yourself. Let me tell you more about this mother. She's out walking in a street in downtown Toronto, just out to go have a coffee with her friend when this bullet rings out. What happened? She was walking in the vicinity of a safe injection consumption site that the government helps run at the federal and at the provincial levels, where guess what? All the addicts get to come together in one little place, and they actually give out government labeled needles and kits for doing all of your different drugs, fentanyl included. Well, guess who hangs out in these areas with all these addicts? Yeah, drug dealers. I've done videos on them before in other places in Toronto. You can literally walk up any time of the day and look, and you can pick out the drug dealers based on their kicks, how expensive their shoes are, and the way that they're walking. But this is a bad place, this square. Why? You've got shootings, stabbings, homicides, overdoses. And why? Why do we have them? Well, let's look back here if you can see behind me. That's a harm reduction center. The harm reduction center, where they give out free needles, crystal meth pipes, all sorts of things to enable addiction and continue addictions. This is the root of our problem. We're enabling addictions. It's no secret. But the police aren't running up busting these people anytime soon. Why? Because it's kind of government policy that maybe you shouldn't hassle around one of these safe injection sites. Well, guess what happens here? One of the dealers is there, they're ticked at the other dealer. And they're working with, they know, one of the workers inside, who she kind of quasi maybe helps people hook them up with their drugs when their addicts need the drugs to do safely in this thing, kind of hooks it up. She knows a bunch of the drug dealers. In fact, testifying at the murder trial for the guy who's alleged to have shot the bullet that killed this mother and ended her life. That ticks me off, I gotta tell you. She said he was considered part of the community. And she said without the drug dealers, we wouldn't have the addicts, and then we'd more or less run out of customers and clients. Interesting, isn't it?
Mohammed, who was working at the safe injection site inside the South Riverdale Community Health Center in July 2023, testified she interacted with drug users and drug dealers alike, saying part of her job was to test the drugs, sometimes offering users and dealers water, cigarettes, or asking them to come inside. It was mentioned to me that drug dealers are part of our community, and without them, we don't have clients. To treat them with respect, they're people as well. The jury has heard on July 7th, 2023, innocent bystander Caroline Hubner-Macarat was shot and killed by a stray bullet during a gunfight outside the safe injection site. Court has heard two associates, named Ahmed Ali and Ahmed Mohammed, robbed Hudson of a satchel before Ali and Hudson began shooting at one another.
The government is helping to fund and continue addictions. I know there's going to be people who call and say, oh, you don't get it, it's harm reduction. Blah, blah, blah. I don't buy into that stuff. If someone you love walks up to you and says, hey, I'm strung out on heroin, I need a hit, and you love them, and they come to you, what are you going to do? Say, let me clean off a needle and get it for you. Here, let me give you $50, or I'll go out and I'll buy the heroin for you, and you can shoot it up in my basement. Is that what you're going to do for them? Or are you going to grab them and get them into some addiction care? That's what you'd do. You turn around and you'd get them addiction help. Well, it's not what our government is doing. We've got issues now where there's too much money in all of these drugs. Even the safe drugs that they give, the methadone, it gets collected and sold and given off to other drug dealers and traded for real drugs. This is not good when the government's helping to cause the problems. Across North America, we have zombie cities. We're seeing them in Toronto, in Vancouver, and certainly down in Philadelphia and other states. You have people walking around, lying on the streets as absolute zombies with these drugs. It's what President Trump is trying to fight by blowing up the narco boats and trying to shut down all the fentanyl precursors that come from China and trying to shut down all the drug dealers coming out of Canada. Yeah, Canada, who's not supposed to have them, and right now they're hunting down a guy that they call the modern-day Pablo Escobar, who's a Canadian. They're arresting a bunch of his cohorts for dealing and running a massive drug empire. Anyways, it's bad enough when the criminals are trying to kill us. When the healthcare is in there too doing it, we need people of character like RFK who starts getting healthcare on health for people. And that starts, I think, many times with just stopping doing some of the stupid things. Anyways, you let me know what you think. Is it good for safe consumption sites? Is it good for us to be in the business of handing out drugs and helping the people do drugs? What about all the different drugs that are put into our food and other drugs that are moved around that we don't necessarily need? We need people of character. What do you think? My name is Ross McLean. I'm a former law enforcement officer, bodyguard to billionaires, and a Fortune 50 security expert. Stay tuned, like and follow if you like the information on my channel, hit the subscribe button, and I'll see you next video.